So as you'll see on the first screen, there is a website that you can utilize to watch a view of someone being resuscitated from overdose. If you just wanted to copy that down, you can have that. But I did want to talk about today, what is an overdose? So an overdose is when an individual has too much of a drug or alcohol or any substance for their body to safely be able to handle. It can be a mixture of drugs and alcohol and again, it's too much for their body to be able to handle. So an overdose can occur from multiple different substances. First, think legal substances such as alcohol, Tylenol, prescription pain medication, or psychotropic medication. And then illegal substances such as heroin, cocaine, or illegally obtained prescription drugs, or a combination of all of alcohol and other drugs. So how does naloxone work on an opioid overdose? We have these little receptors on our brain whose only job is to accept an opioid. So it's kind of like a golf tee with a golf ball that goes on top of it. The opioid goes right onto the golf tee and it stays there. When somebody takes too many opioids, those opioid receptors get flooded and then the person is unable to breathe. And that's what happens during an opioid overdose. So what does naloxone do? It's stronger than the opioid, and it goes and it sits on top of that golf tee, and it kicks the opioids off of those receptors, sits on that golf tee for a period of time to allow the person to breathe again, and reverses the overdose. The lifetime of naloxone is only 30 to 90 minutes. So what happens is after 30 to 90 minutes, it dissolves into the system, it metabolizes into the system, and then those opioids that are left in the body can settle back down onto those receptors, and somebody could actually have another overdose, which is why we ask that anybody who is reversed from an overdose, you call 911 so you can make sure that they're properly taken care of. Most of the medications most opioids last longer in the system than 30 to 90 minutes. If you think about it, you have a pain medication that lasts 4 to 6 hours in the system. If you put, if that naloxone's only on there for 90 minutes, you still have all those opioids in the system to resettle back down onto those receptors. So that's how naloxone works on the opioid receptors in the brain. Wanted to talk to you today about the overdose deaths. As you can see, we slowly but steadily climbed all the way up to 2015, where we had 126. In 2017, Westmoreland County hit 193, and then we started the slow decrease. As of May, the final count of overdoses for 2019 were resulted in 115. So those are 115 confirmed overdose cases in Westmoreland County in 2019. So who is at risk for an overdose? Somebody who has an opioid dependence following treatment or release from incarceration. So once they've been clean for a period of time, their body loses that tolerance that they had increased over the years of use. And they may come out and try to use the same amount or use, as before they went in to treatment, rehab, incarceration, and then they can overdose. So people who inject opioids and people who use potent prescription opioids. Also, people who use opioids in combination with alcohol or other sedating substances such as benzos. Benzodiazepines would be Ativan, Valium, Klonopin, substances such as that. People with medical conditions such as HIV, liver or lung disease, or who are suffering from depression. Their body isn't able to metabolize the substances as the same as somebody who was, say, a healthier individual. and also house members of people in possession of opioids, including prescription opioids. So having any pain medication, any opioids around is a risk for somebody in the household to get a hold of an overdose. It may not be somebody who is an active drug user, but maybe somebody who took a family member's medication. So kids, older people who don't keep track of their pain medications, things like that. How do you know if it's an overdose? So someone who is intoxicated is going to have a small, what we call pinpoint pupils. They're going to be drowsy, but if you do the sternum rub, they're usually able to be aroused. So the sternum rub, if you don't know what it is, you take your fist and your knuckles right here and rub it on the sternum. It's kind of a painful thing. Somebody who doesn't wake after the sternum rub possibly is in an overdose versus intoxicated. Someone whose speech is slurred, almost to the point where it's unrecognizable, and someone whose breathing is more than 10 to 12 times per minute. If their breaths have went down to below 10 to 12 times per minute, you're possibly looking at an overdose versus intoxication. But you can never be too sure. So when in doubt, you want to give somebody Narcan. Again, with what the overdose is, small pupils, unable to arouse, unable to speak. Their breathing is slow, erratic, or they're not even breathing at all. Less than 10 to 12 breaths per minute. Their lips and their fingertips are blue or gray, and they'll make a gurgling or a snoring sound. So possible side effects of naloxone. The reason that we state what the side effects are is what happens is when that naloxone is kicked off that little golf tee, there's no more opiate on those receptors. So somebody is going to go into immediate active opiate withdrawal. So what are those side effects? Somebody could be irritable or angry. Somebody could get what they call dope sick. They could become physically combative. They could vomit, or they could have no symptoms at all because they might not be a regular daily user. Other side effects are disorientation, headaches, aches, chills, crying, diarrhea. They could even be happy or miserable. It's from what my clients and people I know have told me, it's the worst flu you've ever experienced times 10. That's the best way to describe it. So what do you want to do in case of an overdose, and what don't you want to do in case of an overdose? First thing you always want to do, call 911. And then you initiate the rescue breathing, which is 2 breaths every 10 seconds, 1 breath every 5 seconds, just depends on who you're hearing it from, which way it goes. And you also want to put them in the recovery position. So that's where their arms out and you're holding their head up they're holding their own head up off of the ground. We don't want them to aspirate. You never want to leave them unattended. And you want to administer the first dose of Narcan. If there is no response within the first 3 to 5 minutes of the first dose of Narcan, you're going to give them the second dose of Narcan. Now, what don't we want to do? We don't want to put them in a bathtub or ice them down. That's a fallacy that is just, that could actually hurt somebody more than it could help them. You don't want them to vomit or give them food or water. Again, they could aspirate. You never want to leave them alone. And you don't want to give them any other drug other than naloxone. People have been known to do 2 different things. One, if somebody was given an opioid, people feel like maybe they want to give them an upper, something to counteract. That is not going to work because the fact that they're not breathing is what the problem is. Second of all, people have been known to give them Suboxone because they know that there's naloxone in Suboxone. Well, there's naloxone in there, but there's also the opioid as well. So you could just increase the overdose. So we're going to go over PA Act 139, which is the law, otherwise known as the Good Samaritan Law. Any person who is a law enforcement agency, a fire department, fire company, who are acting in good faith. So first responders who are acting in good faith with reasonable care, give somebody naloxone who they believe to be suffering from an opioid overdose. They're immune from criminal prosecution. They're immune from sanction under professional licensing statutes and civil liability, and they are not subject to professional review for such act. They shall not be liable for any civil damage or acts or omissions resulting from such act. So any first responders who administer naloxone to someone is not going to be held legally responsible or sanctioned due to giving them naloxone. They also have to have a training, instruction manuals. They have to have their own special training if a first responder is going to give naloxone. However, for the lay people, for the general public, anybody other than first responders, they do not have to have the training as long as they believe that somebody is suffering from an opioid-related overdose. The only people that this act does not apply to is a health professional who acts with intent to harm or with reckless indifference to a substantial risk of harm to someone. That's the only people that this law does not cover. So the general public doesn't need to have the training. The first responder has to have specialized training, and healthcare professionals who are acting with the intent to harm are not covered by this act. As long as a person reports in good faith the drug overdose, calls the 911 system or campus security, any emergency personnel, and reports that they believe a person is in need of immediate medical attention to prevent death or serious bodily injury to a drug overdose, gives their name, location, and cooperates with 911, and remains with the person until medical attention is there, is not subject to any kind of any type of consequences because of this act. What was happening is you would have people who were together, maybe using together, and somebody overdoses and they would be spending time cleaning up the mess, or they would just leave somebody there and leave because they were afraid of criminal prosecution, or dump somebody off at the emergency department, or something like that. People were so afraid of criminal prosecution that they weren't taking care of the person. So that was one of the reasons the PA Act 139 was became an act. Friends or family were able then to get the Narcan without prescription as well. So you can go to any pharmacy without a prescription and get Narcan. There's a standing order that was put in place by Dr. Rachel Levine, who allowed for people to get Narcan without a prescription. You just need to use your insurance or pay cash price for the general public. Now, the Westmoreland Drug and Alcohol Commission has funded Narcan, for Narcan to be provided to the lay public. And all you have to do is contact the Drug and Alcohol Case Management Unit. We'll provide you with the training, give you the Narcan, and go over all of the steps for a reversal. So before I step into the next slide, which is how to access treatment services, I did want to show you how to actually use the Narcan in the event that that you were to come upon somebody who needs Narcan. So this is what the dose looks like. You just peel the back off, and it's just kind of like an Afrin spray. You put your 2 fingers over it, you press on the plunger, put it up the person's nostril, and spray. That right there was 1 dose. Now, if within 3 to 5 minutes someone doesn't appear to be coming back to, or if there's been no effects of the medication, Then you want to take the second dose and you want to put it up the second nostril, do the same thing. What happens is this medication is absorbed through the mucous membranes in your nose. So someone's not breathing, they're not inhaling it. But if there's any kind of damage or anything to the mucous membranes in your one side of your nostril, it may not be able to absorb appropriately. So that's why they give you the second dose. All this is just until 911 gets there. So that is key. No matter what, we need to have 911 called in any event. The medication needs to be stored at room temperature and can be taken out on excursions. So let's say I was going skiing in the mountains and it was a freezing cold day. I can take it out with me in my bag, but I need to bring it back in and store it in room temperature. I need to keep it out of direct sunlight. If I were going hiking in the mountains, which is funny because I would never hike, but if I were going to be hiking in the mountains, I could take it out on a hot day. I could bring it back in, store it in room temperature. And there is an expiration date on each one. They're good for 2 years. As we know, with any medication, if it goes beyond 2 years, beyond the expiration date, you can still use it, but it may not be as effective as if it was within that expiration date. If you have expired Narcan, again, you can call the case management unit. We can exchange the medication for a non-expired, a current kit. And if you use it, if you have to use Narcan, there is a Narcan utilization packet in each one of the kits. If you get them through us, through the Westmoreland Drug and Alcohol Commission, or a training that's sponsored by the Westmoreland Drug and Alcohol Commission, there is a Narcan utilization report. It's confidential information, so all you really have to do is fill out like the demographics, and then you send it into the Drug and Alcohol Commission, and this does one of two things. One, it allows us to concentrate our prevention efforts into the area where the overdoses are occurring. It also allows you to get a second dose as you utilize the first one already. We had a client, a brother, who called in to us and said, we used 2 kits on my brother. He was taken via ambulance to the hospital. We called our pharmacy and they gave us your number to get replacement Narcan for free. So the brother comes in, gets trained, gets a replacement Narcan kit. His brother's taken to the hospital where one of the mobile case managers from Westmoreland Drug and Alcohol Case Management sees the patient, assesses him, sends him to inpatient treatment services. We follow him through the continuum of care. He comes out and he's still clean today. So that's how this all kind of works together. We provide you with all the information. We can help your family member get into treatment services. We can follow them, offer them other services, which I'll actually be talking to you about in a minute. But that's how all of these services kind of link together. So how do you access treatment services? We have an on-call case manager 24/7 who will answer 24/7 and hook somebody up to services. We also have recovery support services that are available 24/7, and there are also additional support services. So you call the 1-800 number 24/7. Regardless of your funding, we will help you get into treatment services. If someone's in the hospital through the Excella system, the mobile drug and alcohol case manager will assess them and refer them to treatment. We have certified recovery support services, again, free of charge to the client in Westmoreland County. Now, I know there may be some people on this webinar that are not from Westmoreland County, so I did include the website where you can locate your county SCA, or you can call the PA Get Help Now line so that you can access your SCA so that you can find out how you can get into treatment services or how you can be provided Narcan free of cost from your county SCA. Additionally, there are support groups throughout the county, New Freedom Recovery Center, Sage's Army, Lost Dreams Awakening, Favor, and there are family and individual support services through Faith Forward. And then we have also included the NA and AA hotline numbers on here for your reference. So thank you all for being an important part of the solution and recovery as possible. So that was the part of the Narcan presentation and overdose prevention training. We can definitely, if you have any questions, you can reach out to me or we can answer them as soon as I figure out how in this chat on the presentation. But I will go into now what case management services are for the county. What exactly is the case management unit and what do they do? So as Bree had explained before, the Westmoreland Drug and Alcohol Commission subcontracts to the Westmoreland Drug and Alcohol Case Management Unit to provide the case management and CRS services for, for Westmoreland County. Can anybody see that pop up on the screen? Something just popped up.
No.
Okay. What we do is we provide assessment and referral to anyone who has a substance use disorder. We can provide treatment funding for the uninsured or underinsured. So if someone has contacted us and they're uninsured or underinsured, we help them to apply for medical assistance through the COMPASS process, because sometimes it's a crisis situation and they're not able to complete the application on their own. So we will help them. We'll send all the necessary information over to the medical assistance office so that we can get their insurance expedited. Additionally, we will provide we will get SCA funding, Westmoreland SCA funding for those people until their insurance is activated. If somebody already has insurance and just needs an assessment and referral, we'll do that for them. We'll help them with that as well. Once a client is in treatment, whether it be inpatient or outpatient, we follow them through the treatment continuum of care. We also will do daily follow-up. So say we assess somebody today, but there's not a bed at a facility until, Saturday. We will follow them until they enter into treatment services, keeping them engaged through case management and CRS services. We follow them through the treatment process in intervals of 90 days so that we can continue engagement and re-engage them if they have disengaged at any time. Where do we do these services, you might ask? Well, obviously there's office-based assessments, but not everybody can come to the office or is able to come to the office. Sometimes people are in the hospitals. If they're in the hospitals within the county, we'll meet them at the behavioral health unit. We'll meet them at the medical units, the maternity wards, the emergency department. We do that for, once they've been stabilized at the hospital, then we do it for a warm handoff from door to door to treatment. We want to make sure that somebody gets directly to the treatment program from where they're being stabilized in the hospital. We meet people in the community. And we find a confidential setting so that we can meet them where they're at the time and, help them with getting transportation to services because they might not have transportation to an office-based setting. We also meet people in the home. We have a certified a community engagement team who will go into the homes of our high-risk, high-need clients and engage them into services. They also work with the EMS. So if a client has overdosed, EMS calls us, sends us a referral, we meet with the client, we assess the client, we refer them to treatment, and we stay engaged with them throughout the treatment process. Any high-risk, high-need clients who require regular engagement into and throughout the treatment process, the community engagement team will also work with them. Schools. We'll meet with students in the schools of Westmoreland County. The referrals can come in as a disciplinary referral. Somebody got in trouble with drugs, alcohol, vapes. Vaping is a big thing that kids are getting in trouble for in school. They have a drug and alcohol assessment and a recommendation for a level of care. There can also be referrals for non-disciplinary needs. If a student is a student, their family, their teacher, someone from the SAP team determines that the student needs an evaluation, maybe their grades, something's changing, their peer group, their grades, their behaviors are changing, they'll make a referral for a drug and alcohol assessment. All that is done with parent consent. So once the parent consents, we will do an assessment, do a referral to whatever services are appropriate for them, which could be a school-based treatment provider if it happens during the school year. So each school within Westmoreland County has a treatment provider on site, and the student will receive services during their free periods in school. If their insurance doesn't cover the services, the Drug and Alcohol Commission will also pay for those services. So where else might we see clients? We see them at the Westmoreland County Prison. So through the court administrator's contract of Westmoreland County, the inmates are ordered for a drug and alcohol assessment, complete the drug and alcohol assessment, make the recommendation to the courts. Once the client has been deemed legally cleared, eligible for parole or the recommended services, the case manager will complete a medical assistance application with them if necessary, coordinate a referral to the recommended services, ensuring that the referral from inpatient treatment or from the jail goes directly to inpatient treatment services. Also, there's the jail Vivitrol program. So it's a voluntary treatment program at Westmoreland County Prison with treatment services that are conducted through Allied Addiction Recovery for clients who would like to obtain treatment services and medication-assisted treatment prior to their release from the prison. Collaboration occurs between the medical staff at the jail, AAR, Westmoreland County Prison staff, and the case manager to determine if somebody's appropriate for the program. Clients receive treatment services while they're there, and prior to release, coordination will occur for the Vivitrol administration and treatment services upon release, with the client choosing their community-based MAT provider prior to being released from jail so that we can continue to follow up with them through the continuum of care. And so we follow through with them throughout those services. And then finally, the other service that we provide is called coordination of services. So this is assisting people with their non-treatment needs. So we help them to access safe, sober housing. There is funding available for low-income families. You know, we help them to find a safe recovery environment. We help them find transportation, employment, such as help them with resume building and employment searches, getting into employment assistance agencies. Physical health care needs, a lot of people haven't taken care of their physical health, so we'll help them find a PCP, help them find dental. Dental is a big thing that happens that we have to help them find services. We help them find childcare, and all other non-treatment needs so that we can focus with them on the non-treatment needs while their therapist helps them to focus on their treatment needs and building a strong recovery program. As I said, all of our services, all of our on-call emergent care services are 24/7. So anyone would just call our 1-800 number. At any time, we have a case manager and a CRS on call. At this point, I'd like to hand it over to Pete. Let me just check real quick because I think there was a question real quick about the slide regarding the signs of overdose. So I'm gonna figure out how I get back to that. The difference between intoxication Oh, I'm kind of stuck. There you go. So the difference between intoxication and overdose is somebody who's able, they may be drowsy, but they're able to be aroused versus somebody who is unable to be aroused and unable to speak. The breathing being more than 10 to 12 times per minute, or it could be absent. And then the lips and fingertips, blue or gray, gurgling and snoring noises. I hope that answered the question. We have one person in the chat. Looks like it was about the people being able to hear. So now I'm going to hand it over to Pete Schaefer, our CRS team lead, so he can talk to you a little bit about what our certified recovery specialists do.
Ooh, thank you, Cal. Hi, everybody. I hope everybody's well. My name is Pete Schaefer, and I'm the Certified Recovery Specialist Team Lead for Westmoreland Drug and Alcohol. It's a mouthful. I've been here for almost 2 years. It'll be 2 years in August. I started as a CRS at that point, and about 6 months ago, I was promoted to Team Lead. So what is a certified recovery specialist? What does that mean? We offer voluntary, confidential one-on-one services to people seeking additional aid in their recovery. We meet, what we like to say is we meet the clients where they're at. I'll explain real briefly what this credential is and how we get it, and then I'm going to go into more what we do. So to get this credential, it's obtained through the Pennsylvania Certification Board. One of the requirements is 15 months living a life in recovery. So I'm a person in long-term recovery. Almost got about 4 years I'm coming up on. And the next, excuse me, the next part of this credential would be the training time. This is a course that goes over a period of 2 months, a total of 56 hours. There's a test at the end, obviously. And then there is a research certification. So I need to recertify every 2 years with 30 hours of continuing ed. 6 of those hours must be in ethics, 3 of those must be in confidentiality. Once all that requirement is met and you pass your test, you're good to go. What we do, and I like to say, and just to break it down in my own words, is we're people who are in recovery, who are helping people who are early in recovery, trying to get back what they lost, or trying to get what they never had. Our background and being there and coming through, knowing the ins and outs of the recovery community and knowing the bad parts about it and already been there, kind of puts a new kind of experience. It gives our clients a little advantage because we've been there, we've told those lies, we've done those activities. So as a peer, we can relate really, really well to them. I find our service really, really beneficial. It's really a fun, wild ride. Some days aren't always fun, but it's a great experience. I manage a staff of, there's 7 of us. We're open-minded to recovery. We don't follow one set path. When somebody comes to us, we're not going to say, okay, well, we're going to do these 12-step meetings and that's all we're going to do. That's not it. I mentioned before meeting a recovery where they're at or meeting a client where they're at. What I mean is, one of the first questions that I'm going to ask a client is, describe recovery to me in your words. And when I hear that response, that's where I start. Some people might not be into 12 steps. Some people might be something else. They might look at a different recovery program. They might be looking towards their church. They might be just looking to health, general overall health. Let's go to the gym. The important part of recovery is making connections. And what we want to do as a CRS is facilitate those connections to whatever that person needs to keep them in recovery. So it's very interesting with this job. Just seeing the clients grow and seeing how many different ways there are to do this. They're constantly teaching us stuff, as well as they're getting information from us. It's a shared experience for sure. But we are extremely open-minded. We want to cover all bases, or if somebody just wants to focus on one, that's fine, we'll do that too. I like to tell them, look, you're going to drive this recovery bus, and I'm going to put the brakes on whenever we need it, and then we can regroup. Again, I want to thank my staff because they truly are amazing. They have a lot of different backgrounds in recovery, and they're just a great asset to have. Our schedule, I just want to touch on that real briefly, like what that would look like. Well, it's different from everybody, okay? Typically, let's just say a typical average client, we're going to meet with that client one time a week, hopefully about an hour, 45 minutes to an hour. Now, this can differ, obviously. Some clients are higher need. They are going to be met more often. Some clients, as they go through the process and they get stronger in their recovery, might be met once a month. They just need to touch base, just come in. And some clients that might do really well, and then they start having a tough time, God forbid there's a tragedy or something like that that is affecting them, we're going to up that schedule. Communication is the key here between us all, and the more we communicate with our clients, the better that they're going to be. That being said, where do our clients come from? So we have a couple different sources. One would just be the community, and that's somebody that heard about us somehow, a brochure, or word of mouth, that they had a buddy, or who knows, but they walk in off the street and they say they want a CRS, and that's great. Come on in. We are involved with a lot of different rehabs around the area, our inpatient treatment providers, and they send us a lot of referrals as well. We'll get a referral from them. If that happens in that process, what we want to do is we want to contact that treatment facility, and we kind of want to do a warm handoff with them, where maybe we can go to that facility if they're close enough and visit for a little bit with the client. Maybe we can't do that. If we can't, what we want to do is we want to bridge that gap via a phone and have a conversation. Just so it's not a cold meeting when they come out. So they already know us a little, we already know a little bit about them, and just makes that transition a lot easier. Clients are also referred to us through different outpatient programs. Again, we can stop over and see them, or that phone call always comes in handy as well. That warm handoff process is so important. We also work with Westmoreland County Drug Court. Each drug court participant is assigned a CRS worker. So we work within that system as well. And then within the jails, real briefly, I'm going to touch a couple things on that jail. Obviously, we get, sometimes we get clients that are referred to us that are coming out of the jail. We do offer a jail group, a recovery group that operates on a weekly basis in the jail. That goes for 7 weeks, one time a week. There's a group for the men, and there's also a group for the women. And I think that pretty much, oh, I'm sorry, I missed one thing with the jail would be the Vivitrol program. So, the jail is a program with people that are exiting that are on Vivitrol, and they will refer them over to us just so they have some extra support in their recovery when they get out. That's another referral source. Point is that I really want to stress is we'll take anybody at any time. We don't care where you're coming from. We do work on slowly within Westmoreland County. So this does happen occasionally. We'll get a referral that, might be from a neighboring county. And they're going back to that neighboring county, say that would be Somerset County or something like that. We wouldn't be able to work with that person, but yeah, we can hook them up with all the resources in Somerset County to make that transition smoother. We know how, we just want to make that as easy as possible for anybody that we come across. So anybody that ever has questions, it doesn't matter where you're from, if they call us, we're going to help, or we're going to try our best, our very, very best. I kind of want to also touch on exactly what is it we do as far as in our appointments and things like that. We educate in the recovery process. It's probably a pretty broad stroke, but there's a lot of times where, let me just use this as an example, where I'll have a younger person, say somebody who's 18 years old that comes in, they've never been to rehab, they're obviously having some substance use disorder issues, and they don't know anything about the recovery process. And a lot of times they are scared of rehab, and that's not where we want them to be. Being through multiple rehabs and being through that process and putting them at ease and letting them understand that it's not about jail and you're not going to get beat up, and you're going to find like-minded people that are just like you, that want to get better. That's where the education process comes in, I think, the most, is just being there and just telling them that's what this is, explaining what a halfway house is, explaining what a three-quarter house is, what a 12-step program is, what a smart recovery program is. We want to get all these questions answered. We want them to feel comfortable so they can move on and make that first step into recovery. Recovery plan. This is really where the CRS operates. This is something that we are going to refer to in every appointment. This is a small plan that we have set up for our clients. And it's simply goals. But what we want to do with these goals is, obviously we want to make them achievable. Sometimes we'll have people come in and they're like, well, I want a job. Okay. And the next question I would ask is, do you have a resume? And no. Okay. So let's start here. Let's start at the resume. Let's break this goal down into small increments and let's work on this goal of a job. It's just kind of realigning and prioritizing what they need. That recovery plan, like I said, we go to every week, and we will adjust it as we go forward. To see this progress happening, to recognize their progress and celebrate this and give them pats on the back. I mean, that's what they need. They need encouragement. And this is our little written path. So we know where we're going. We know everybody's path's going to be different, and we're just tracking it. We also, we make referrals out to our case management unit. A lot of times we will have clients that, again, I mentioned the young person earlier that needs treatment. So immediately we need our case management unit to put that into play for us. And once we have that contact, we would help somebody into the treatment facility. We're going to track them in that facility as well. Again, this is where we've already met them, right? So it's not really a warm handoff, but we want to stay in contact with them. So whether that be phone or whether that be face-to-face, we're going to track that person while they're in rehab. And that way, it's more comfortable for them to come back to us when they get out. We just want to position them basically for long-term success. And by doing that, we want to give them access. This is where we become essentially a resource broker. We want to gather all of our community resources, because depending on who this person is, we don't know. Some people are going to need food. Some people are going to need clothing. Some people we can help out with housing in certain situations. Again, some people need employment. We have outside resources like CareerLink or PIC. We can help people with building their resume. Some people have never done that before. We want to show them how to do it. You know, there's another company that we work with that works with us right now, LifeWorks, and they've been a tremendous help to us as well as getting people employed. Transportation. A lot of our clients don't have transportation. You know, there's can be a various amount of driver's license issues that come through this process of being an active addiction. So we want to introduce them to, I know in Westmoreland County, we have the Go Bus, Go Westmoreland, MATP. We want to access that and say, this is how you can do that. Some people don't understand how to access Uber. We want to make them aware of that. Or the just overall general bus schedule. But letting them know that these resources out here, because sometimes people don't know they're there. And in particular, this Go Bus will get them to all their medical appointments. They can bring them right to our office, or they could, you know, take them to another physician's office. Also, health services too. You know, we refer a lot of people to the Department of Health, which is really close to our office. We have a free clinic that's right around here. A lot of times, people don't even understand what a PCP is. Okay. So we can help them find that doctor for that healthcare that's so important. Years and years of addiction do not bode well on your body. So it's important that we get the body healthy and the mind healthy. The more we combine those two, the better off we're going to be in the future. A lot of times we provide introduction to the recovery community. Obviously, with the 7 people that work up here, we know a lot of people within this recovery community. We participate in the recovery community. And sometimes we come across people that just are nervous. They don't want to go. They don't know what to expect. And that anxiety will keep them out of a meeting or keep them away from going to a therapist or something like that. But we can walk into that meeting with that person. We can say, hey, I'll meet you at such and such place. Or just simply, this meeting is at X amount of time and it's over here at this, show up there. But sometimes we will walk into that meeting just to make them feel comfortable. If we have friends in there, obviously confidentiality is always key. But we can introduce people. And that seems to really, really help out, makes our client be at ease. Just to get in the door and meet the people that are in those meetings. Once they can see that everybody's really nice and everybody's welcoming, and this is the first time they've ever been in a meeting, so you actually are the most important person in that meeting. They need to understand that, and sometimes they need a little help with getting across the line. Our services are face-to-face. We do have meetings in the office. Now, obviously, we are on COVID times, so at the moment, we are doing everything via phone. We access FaceTime, we access Duo, or just regular telephone calls. Hopefully, time will tell, but when we get back to face-to-face, we have clients in the office. We also will go out in the community and meet our clients as well. If they wanted to meet at a restaurant, at a park bench. We don't go into homes, but we will meet them anywhere in a public place. We're mobile, we all have cars, we all have driver's licenses, so we will come to them if need be. I'm wrapping everything. Oh, I'm sorry. The big one today, right, Kelly, was Narcan. We do offer Narcan training in our office. I know everybody's going to get this information via email, so if you need Narcan, we can come in and we can train you, or you can come in and we can train you. Now, during these times, we can do this over the video. We can deliver this stuff to you if you need be, if you're in our local radius. We can do drop-offs. You can come to the office, you can pick it up at a reception desk. It's very important that it's out there. It's saving so many people's lives. So if you need some, ask. We're always here to help. When we get back up and running full steam, if you want to come in and we can sit down and we can do it face-to-face, that's great. We'll do that too. Whatever means we need to get this Narcan to you, we will get to it. Just please ask. And that sums it up for me. I wanted to thank Westmoreland Drug and Alcohol Commission for letting us do this. I want to thank everybody who's out there, who's listening. I was extremely nervous. This is the first time I've done something like this, but I feel much better now. I guess we got to check for some questions, right?
There is one question. Somebody asked, how many clients does a CRS work with at a time?
Okay, so the way we do that is we have full-time and part-time staff. A full-time CRS, excuse me, I lost my words, right? Full-time CRS carries a caseload somewhere between 27 and 30 people. Sometimes they'll have other obligations, like I mentioned the jail group, which obviously that's going to take up time during the week. So their caseload would be lowered a little bit. Part-time people, most of my part-time people right now are carrying a caseload. They work about 30 hours, and they carry a caseload of 24. And then we do have another CRS who works 16 hours a week. No, he works 12 hours a week. His caseload, I believe now, is 8 or 9. So it varies length of time.
I also wanted to mention, I don't know if I mentioned this earlier, but if your agency wants a training for Narcan and overdose prevention training, we can do that. All of those trainings need to be coordinated through the Westmoreland Drug and Alcohol Commission through Bree Minardi, and we would come out to your location, provide the Narcan training, and provide the kits as necessary. As well, we do community Narcan trainings. During non-COVID times, we were doing them once a month, and we have the advertisements sent out through the Westmoreland Drug and Alcohol Commission and other various entities so that you can see, and then we can have a community Narcan training as well. We have them both in the day and in the evening, during the work day and during the evening. So those can also be done for you. And somebody had asked earlier if we have a Menneson office, a Mon Valley office. We actually meet individuals anywhere within the county. We've even went a little bit outside the county if we needed to meet somebody. If there's an office location close by that we can meet them at, we'll do it there, but we'll meet them wherever they are comfortable, wherever is best for them. During COVID times, the in-person assessments have decreased, the in-person appointments have decreased. We've done a lot of telehealth services, and we do have that available. We were actually lucky enough to have telehealth services available to us prior to COVID, so it was an easier transition for us than it was for maybe treatment providers and things like that. So we can provide a telehealth assessment and immediate referral to treatment services for someone without even face-to-face contact through our after hours and emergent agreements. So that was something that I don't know if I touched on before, but just wanted to reiterate to you. So we also had the question of, have you had an increase in request for Narcan during the pandemic? We actually haven't. In the beginning we had some, but I know that there are other entities that have been doing porch drop-offs. They are utilizing the kits that we have here. So I'm guessing there is an increase, just not specifically at case management. It's through the Westmoreland Drug and Alcohol Commission, but not at case management. So I hope I answered your question. If anybody else has any questions and you want to throw them into the Q&A real quick, we can answer those. We have a couple minutes left.
What's the youngest age? Can I be heard now?
Yes, you can.
Okay.
Yeah.
All right. Youngest age, 18.
Yeah, unfortunately, Donna, there aren't CRS services for adolescents at this point in time. It definitely would be beneficial, but it's not something that that is available now.
Oh, is that another one?
So doesn't look like we have it doesn't look like we have a lot more questions. I just want to reinforce with you the key points of today. Narcan training is available. Narcan is available. Honestly, if you need it mailed to you, we can mail it to you. We can do a porch drop off. Any way that we can get it to you, just call our 1-800 number. It's 1-800-220-1810. We will talk, we'll make a plan for you, whether, like I said, if you mailed or porch drop off, get it out to you, meet you somewhere in public, however you want to do it, we'll meet with you and then we'll get you the Narcan that's available. We actually have a little flyer together that gives you the instructions, because we all know that in a time of crisis, our brains don't always work the way they would normally. So we have the instructions available. There's little cards on there for Narcan. Again, our phone number is 1-800-220-1810. And that phone number answers 24/7. If it is after normal business hours, you get connected directly to our professional answering service, who will warm hand off the call straight to us. They will transfer the call straight to us, and we can answer any questions. We can help you with any referrals. We can, do whatever you need. Let's see, there's something in the chat down here. I don't see where it is. I just see a number 1. I guess it's gone.
I think it was just a question about sound, which was.
Oh, okay.
That was
It keeps popping up.
Yeah.
I put the number in there too, Kelly. I put the 1-800-220 number in.
Wonderful. And then Julie, I actually gave Julie our flyer with all of our information on it, that just basically is a brief overview of what we do. And she'll send it out with the certificates post webinar.
Yes, Sarah, you'll get an email from Sarah Opolinski. She sends out the certificates.
That's right. It's Sarah.
Yeah.
Thank you.
You're welcome. So if there's no other questions, I want to thank Kelly, Pete, and Bree for doing a wonderful job on the training and giving you guys some good information. And if you have any other questions for them, you'll be able to call the 1-800-220 number and get a hold of them. Or I think, is there other contact on that sheet, like your email or anything? Or do you want us to share your emails?
You can, you can share our emails. That's fine.
Okay, we'll share their emails as well if you have any other questions. So other than that, I guess everyone can go enjoy the rest of this day, the beautiful day, nice and warm again. Maybe Kelly can go hiking. So
that is such a funny thing. If it's a flat surface on a road, that's it. That's me.
So Sherry said great information. So, well, that's it, guys. So thanks again for doing the webinar, and I guess we'll see you soon, hopefully, right?
Yes. Thank you. Thank you, everyone who participated. I appreciate it.
Thank you, everybody.
All right, thank you. All right, bye, everybody.
Great job, guys.